Flu Prevention, Health Education Seminar. The information presented in this presentation is for informational and educational purposes only and should not be used to diagnose or treat any known or unknown medical symptoms or conditions. If you are experiencing any signs or symptoms of illness or think you have a medical condition, it is recommended that you consult with your physician. During this presentation, we will be discussing the following topics on flu prevention: why it's important, the facts, what it means to you, quick tips, and next steps. Now, let's get started. Quick poll. What is the best way to prevent getting the flu? Is it A, staying home during flu season, B, washing your hands daily, C, getting the flu vaccine, D, taking antiviral vitamins, or E, all of the above? The correct answer is C, getting the flu vaccine. All of these practices and solutions will help prevent you from coming down with the flu, but being proactive and receiving your flu shot annually is the best method of protection. So what are the facts? Influenza season begins around October and extends through April. The peak time of year for the flu is January and February. Total costs are estimated at about $80 billion every year. And annual flu epidemics cause 600,000 life years lost, 3 million hospitalization days, and 30 million outpatient visits. Flu vaccinations become effective about 2 weeks after receiving them, and they expire near the end of June the following year. Therefore, it is very important to receive a shot annually. Because it takes about 2 weeks after the vaccination is given for antibodies to develop in the body and help protect against the influenza virus, it is important to try and get vaccinated as early in the flu season as possible. This is a slide from the CDC showing the number of influenza-associated pediatric deaths by week of year. Numbers vary based on the severity of the flu each year. You can see that 2012 was a mild year with only 26 total pediatric deaths, while the 2010 flu season had a high of 282 pediatric deaths. Epidemiologically speaking, if we are able to vaccinate the entire pediatric population, all children 6 months and older, we would see a significant decrease in influenza-related illnesses and deaths. Because of their age, pediatric patients have weaker immune systems and less history of exposure to illness, making them more vulnerable to foreign invaders like influenza. During the 2013 to 2014 season, the CDC received reports of severe flu illness among young and middle-aged adults, many of whom were infected with the 2009 H1N1 virus. More than 60% of the flu-associated hospitalizations reported were in people 18 to 64 years old. A similar increase in hospitalizations among non-elderly adults was also seen during the 2009 H1N1 pandemic. These statistics serve as a reminder that the flu can be a very serious disease for anyone, including young, previously healthy adults. Hospitalization rates were also affected during the 2013 to 2014 influenza season. While rates were still highest among people 65 and older, people 50 to 64 years of age had the second highest hospitalization rate, even higher than the rate during the pandemic in 2009. So what does this mean for you? The flu is a highly contagious viral infection that affects the upper respiratory tract, including the nose, throat, and lungs. It spreads through droplets. This can include coughing, sneezing, talking, or touching objects and surfaces containing germs. A person can be contagious one day before their symptoms occur and up to 5 to 7 days after the illness has started. Complications of the flu can affect anyone, but can be more severe and life-threatening in older adults, children, and people with chronic illnesses. People with the flu have all or some of the following symptoms: fever or chills, cough, sore throat, headaches, fatigue, total body aches, and nausea or vomiting in children. Because the common cold and the flu share many of the same symptoms, it can be difficult to tell the difference between them. In general, the flu is worse than the common cold. Symptoms such as fever, body aches, extreme tiredness, and a dry cough are much more common and intense with the flu. Colds are usually milder, and people are more likely to have a runny or stuffy nose. In patients with high risk of complications, a flu test can be performed by a physician. For most people, however, a test is not required, but the physician will recommend diligent self-care as being of the utmost importance. Some further complications of having influenza may include bacterial pneumonia, ear and sinus infections, dehydration, and worsening of chronic medical conditions such as congestive heart failure, COPD, asthma, and diabetes. Complications from influenza can range from mild to severe, but those people at high risk, children, adults over 65, and anyone with a chronic illness, are more likely to experience the severe, sometimes life-threatening complications. Now it's time for a quick poll. Can you get the flu from a flu shot? Think you have the answer? This is a common misconception, but the answer is in fact no. The flu shot is a dead virus, meaning it's inactive and cannot give you the flu. Minor side effects may include soreness, redness, or swelling at the injection site, a low-grade fever, aches, or nausea. There is, however, the influenza nasal spray that is available and formulated as a weakened live virus. In very low percentages, it can cause mild, cold, and flu-like symptoms for a very short period of time. Luckily, it will be much less severe than full-blown influenza. There are 3 simple steps you can take to fight the flu. Number 1, take the time to get vaccinated. Number 2, take everyday preventative actions. And number 3, take antiviral medicines if indicated by your physician. As mentioned previously, annual flu vaccines are the best prevention. Everyone 6 months and older should get vaccinated. People with high-risk conditions, such as asthma, diabetes, heart disease, and cancer, pregnant women, and people over the age of 65 are an absolute must for receiving vaccines. If all children received flu vaccines, we would see a significant reduction of flu illnesses. Vaccines are formulated to cover several flu viruses, including influenza A, B, and H1N1. A new vaccine is formulated each year because flu viruses are constantly changing. However, the vaccine will not protect against all strains of the flu. Due to the fact that the vaccine is updated annually, and our body's immune response from a vaccination decreases over time, it is imperative for people to remember to get their flu shot annually. The CDC and FDA closely monitor the safety of all vaccines before, during, and after their distribution to the population. Vaccine Adverse Events Reporting System, VAERS, is a voluntary reporting system that accepts reports from the public on adverse events or side effects related to vaccines available in the United States. It is VAERS' job to detect these new or rare events as a result of vaccines, monitor any increases in these events, identify patient risk factors that might make them more susceptible to these events, keep track of specific vaccines with increase in type or number of reported events, and monitor the safety of all new vaccines. Vaccine Safety Data Link Project, VSD, is an ongoing collaboration between the CDC's Immunization Safety Office and several other healthcare organizations to monitor vaccine safety and conduct studies on the adverse events reported after immunization. They have conducted research on 9 million people to identify and confirm side effects of vaccines. So you may be wondering, is there anyone who should not get the flu shot? This is a very good question. Any individuals that have had an allergic reaction to a flu shot previously should not receive the vaccine again. Also, individuals that are allergic to chicken eggs should be cautious and only receive the egg-free vaccine that is available. These individuals should check with their healthcare provider for more information. Here are some other important preventative measures to keep in mind during flu season. Cover your nose and mouth when you cough or sneeze. Wash your hands frequently with soap and water or an alcohol-based sanitizer. Avoid touching your eyes, nose, and mouth. Avoid sick people if you're healthy, and avoid contact with healthy people if you're sick. If you are sick, stay home until your symptoms have resolved. This should be at least 24 hours after your fever has gone away. Routinely clean and disinfect frequently touched objects and surfaces like doorknobs, keyboards, countertops. Any of these and more could be contaminated with germs. In more extreme cases, there are prescription medications available to treat severe flu symptoms. These are different than antibiotics. They fight viruses, not bacteria. They are prescribed to help shorten the illness, decrease the severity of symptoms, and prevent serious complications, but they will not cure the flu. They must be started within 24 hours of experiencing symptoms. These are often reserved for children, people hospitalized with the flu, or those with chronic health conditions. Common influenza antivirals prescribed are Tamiflu and Relenza. These are usually prescribed for at least 5 days. However, most healthy people who get the flu do not need to be treated with antiviral drugs. The following are some important things to remember if you have the flu. Stay home until at least 24 hours after your fever resolves. Make sure to hydrate. Drink lots of water and other healthy fluids. Avoid other people, especially those at risk for developing severe reactions to the flu. And if your symptoms are severe and you're worried, make an appointment with your healthcare provider. These are some emergency warning signs in adults: difficulty breathing or shortness of breath, pain or pressure in the chest or abdomen, sudden dizziness, confusion, severe or persistent vomiting, and flu-like symptoms that improve but then return with a fever or a worse cough. These are some of the emergency warning signs in children: fast breathing or trouble breathing, bluish skin color, not drinking enough fluids, not waking up or interacting, being so irritable that the child does not want to be held, flu-like symptoms that improve but then return with a worse fever or cough, and fever with a rash. At this point in time, you may be asking yourself, should I get a flu shot? You can utilize this shared decision-making tool found in the Health Library on your wellness portal to help you decide if getting a flu shot is right for you. Now it's time for some quick tips. You might have heard personal anecdotes from family or friends that they didn't feel well after getting a flu shot, and you may be wondering why that is. The most common side effect of seasonal flu shots in adults has been soreness at the injection site, which can last up to 2 days afterward. The soreness is often caused by the immune system beginning to make protective antibodies from the killed viruses in the vaccine. According to the Advisory Committee on Immunization Practices, rare symptoms include fever, muscle pain, and feelings of discomfort. If these problems occur, they usually begin soon after the shot and last only 1 to 2 days. You may also be wondering, but what about those people who get the flu vaccine and still get sick with flu-like symptoms? Well, there are several logical explanations for this. 1. Those people might have been exposed to the flu virus days before getting vaccinated and coincidentally develop flu symptoms shortly after getting the shot. 2. Non-flu viruses, like rhino or adenovirus, will cause flu-like symptoms. The flu shot does not protect against these. 3. If a person is exposed to a strain of the influenza virus that is different than the viruses used to create the vaccine, then an illness will result. The ability of a flu vaccine to protect a person depends largely on the similarity or match between the virus or viruses in the vaccine and those in circulation. And 4. Some people with weaker immune systems will not develop enough antibodies to fight the virus completely, but in most cases the vaccine will help them experience less severe symptoms. So what's the bottom line? The flu vaccine provides the best protection available from seasonal flu viruses. Next steps. Wash your hands as much as possible. Cover your mouth when you cough or sneeze to avoid spreading droplets. Receive your seasonal flu vaccine. The more people who are vaccinated, the less likely the flu is to spread through populations. Flu shots are offered by doctors' offices, clinics, college health centers, pharmacies, hospitals, and many employers and schools. There is even a high-dose flu vaccine available for people 65 years of age or older. If you have symptoms that you're concerned about, make an appointment to see a doctor or your primary care physician. And lastly, take action against your symptoms. For more information, please check out the following references: CDC, Center for Disease Control; Carolyn Bridges, Effectiveness and Cost Benefit of Influenza Vaccination of Healthy Working Adults; and Kristen Nickel, The Effectiveness of Vaccination Against Influenza in Healthy Working Adults. And that concludes the Influenza Seminar presentation. Thank you all so much for your participation.